Hospital beds have been filled, gone empty with those who haven't made it through, just to be filled once again in the never-ending cycle of this deadly virus that's sweeping through the land. Parents have been forced to become instant educators while attempting to balance working from home and school assignments given by exhausted teachers. The small businesses are suffering the most as COVID-19 has presented owners with impossible decisions to make. How will people get through this emotionally, mentally, and financially? Today, our panel of experts will answer the hard questions and bring to light some of the information that has been missing in some of the news outlets. By the end of this special, viewers will have a better understanding of the coronavirus and be able to make better decisions to remain safe and, most importantly, alive during this global pandemic. Thank you so much for tuning in to COVID-19 streaming special. I am your host, LA Holts, and I'd like to welcome and introduce my prestigious guest panelists. I'm going to ask that each of you, if you would please do us the honor of giving a little bit of background about yourself, your educational background, if you will, and anything else you want to say during this introduction. So I want to first thank Dr. Maya Green. Thank you so much for joining us, and please go ahead and give us a little bit about yourself.
I am a facilitator of healing, and that's my purpose. My purpose is to go into communities, provide structure, listen to what healing means for that community, and then facilitate that. It's basically founded on the notion that all the answers to the healing or whatever ails the community, the answers come from within that community. Nowhere in history does historically oppressed culture come out of oppression by the hand of anyone that oppressed them. It's always from within themselves. So that's my purpose. And my position right now, I'm the regional medical director for a system called Howard Brown Health. We serve the Chicagoland, founded in 1941, specifically serving the LGBTQ community, but definitely really expanded to be all inclusive and not exclusive. Right now, we are doing a lot of work in Black and Brown communities, no matter what someone's orientation is, religious background, or anything like that. That opens a lot of doors because definitely people in my community, specifically the African American community, are in many facets and members of many different many communities. And so being able to do that and being able to do an environment where someone takes the mask off and receives affirming care is great. I gotta mention my undergrad, Alabama A&M. I'm an HBCU grad. That was undergrad. So I got my medical degree from University of Illinois at Chicago College of Medicine. It was a dual degree with a master's in public health. My focus is health policy and administration. And my specialty is family medicine with a fellowship in HIV medicine. That doesn't mean someone needs to have HIV to see me. I see people with or without HIV. I just work in communities that historically have been heavily impacted by HIV.
Hello, I'm Suzanne, and I have been a nurse almost 10 years. I moved to Houston, Texas from Portland, Oregon to go to nursing school to do a second degree accelerated nursing program. So I have my bachelor's in biology and a bachelor's in nursing. So originally my experiences were at an oncology-based hospital called MD Anderson in Houston. And then I started doing travel nursing, which is where I met my lovely Mrs. LA Holts. And we became friends in one of the cities I worked in. I did travel nursing for about 5 years, working West Coast all the way over to the East Coast. And then I stopped doing travel nursing this last August, and then COVID-19 happened. So I've been working in Houston once again, and then I went back up to New York City for the pandemic. So I just finished working there, and as you can see, I'm in Florida right now quarantining. I just got done working my assignment up in New York. I was just finished in the epicenter of all of it in New York City, working at a community public-based hospital in Brooklyn. So
Well, I'm a DePaul Law graduate, 2012. My focus is in business law. I'm licensed in the state of Illinois as well as in the state of Texas. I lived in Texas for a few years where I practiced business litigation, commercial litigation, representing a lot of mid-sized and commercial businesses. Recently, I've switched over to compliance, where I actually work in the corporate sector, predominantly in the financial services industry. So we are doing a lot with consumer lending and loans and business loans. As entities, individuals and businesses are directly impacted financially by COVID, as well as processing CARES Act funding that has been provided through the government for small businesses as well as relief for consumers. So I primarily work with consumer regulations as well as some commercial regulations as well.
Sure. My name is Jennifer. I am a school teacher for, this is 16 and a half years now. Same school district in Dalton, Riverdale area. And then in the summertime, I teach at a camp called Whiz Kids Camps. And it is now a V Camp, which is virtual online. So if you're a parent and you're looking for something for your children to do, join Whiz Kids. It's a great opportunity. I also have a big fitness background. I've been a trainer since I was 19, so about 22, 23 years in that field. And my husband and I also own a t-shirt company called 838 Apparel.
First and foremost, thank you, LA, for allowing me to be a part of this community of experts. My name is Kristie King. I am a corporate economist by skill. My heart's invocation is education, leadership, and management. And I just kind of call myself the connector, being able to be utilized in capacities where we bridge the impact of everyone's proficiencies to have some really good results. My background stems a couple of different MBA, MSF, MAT, most recently a master in development and education from Harvard University, which has just opened my eyes up tremendously to a lot of the disparities that we have in the world, from professional, personal, race, ethnicity, financial, community. That's it.
Absolutely. Well, thank you so much. I appreciate that. So I want to thank you all very much for joining me today. And the purpose of this particular, I call it a COVID-19 streaming special, is because I want to educate the people from a perspective of the experts, because as you know, there are so many things going on right now and so much misinformation getting to our communities in particular, that a lot of people who are not experts are just simply confused and really don't know what to do in business, economically, professionally, educationally, especially medically. So this is why I'm having this, because I want to help people get an understanding of what's going on from the experts' mouths. That's what this is for. And like I said, I believe that this particular series, or not series, but this particular streaming special is going to save lives once they apply what you all are going to say to them.
Remember the mask education, the education regarding should you wear a mask, what type of mask should you wear, and how you should wear that mask. It's still important. So historically, when we first started and coronavirus first hit the U.S., we were really focused on those N95s because we thought that the coronavirus was aerosolized, meaning it would be able to be substantially pushed, and its particles will be pushed through air, right? N95 masks are still good, but now we know you can wear a surgical mask. Which are the typical blue and white or purple and white masks. And in a lot of places, we talk about cloth masks. It helps if those cloth masks have a little pocket that you can put a coffee filter in, but very important. Mostly important is no matter what mask you choose to wear, over all the way over the nose and all the way under the chin is very important. If my nose is out and my mouth is covered, the mask isn't really providing the level of security that I need. The other thing I would say is I was out there, I protested. Um, we, in our own way, take part in that. That was just my way. I did stay 6 feet away from anyone that wasn't my quarantine partner. I mean, and if you didn't come out of my house and we ate the same food and we were in the same space, then I did stay 6 feet away. I did carry my little hand sanitizer. I absolutely did. And so those were the things. Wear your mask all the way over the nose, all the way under the chin. Carry that hand sanitizer and maintain that 6 foot distance where at all possible. So that's how you can stay safe from COVID while protesting.
I would recommend that you begin with like equity. Like being a school teacher in it's probably 98% poverty stricken. The playing fields aren't level. Like they don't have the same curriculum. They don't have the same technology. So that has really been a challenge to transition to e-learning, because some families have 5 kids and 1 cell phone, and we're trying to do stuff online and check in on Class Dojo, and you know, sometimes their parent has to work, so the cell phone is gone, so they can't do the homework till they get home at 8 or 9 o'clock at night. So we had to improvise. We have a great principal, and we had to come back to school, before we left, we made packets for 6 weeks. Then we started the online learning, and then we came back again and made packets till the end of the summer. But it's very challenging for the students and parents in my community, because they, it's not the same. That even if you go to like a district like Homewood Flossmoor, every kid has a laptop. Every kid has, access to that, and it's just really unfortunate that it has been like that for a long time. And it makes me sad, because the school districts that have the most money, I think that they could at least be generous enough to adopt a school and really take them under their wing, so that they have the same access to and the same level playing field. Yeah. So I would start there. I mean, and I also believe that standardized testings are biased. I don't agree with them. I think they set kids up for failure. A lot of the children that I teach have what they call ACEs, things that have happened to them that somebody from a Caucasian community or a Caucasian or a privileged community, they have never had to deal with. Talking about molestation, or a parent, I had at least 3 kids of mine's dad was in prison, just things that they had to go through, and that's just like emotionally taxing a child's brain. So it's really hard if that social emotional piece is not set up for them to be successful, for them to be able to talk through some of those things and get counseling and services. It's nobody cares about a noun, a verb, or an adjective. I mean, that's really hard to focus on when you have all of this baggage going on at such a young age. So I would start there. It needs to be social emotional learning has to be a big piece, and it also has to be even playing fields, because the brown and black community have not had good, not all over, but where I teach, it has not been even playing.
One thing that is clear is that in the aftermath of this, there are going to be a substantial increase in litigation lawsuits directly related from the COVID-19. So one thing is going to be contract procedures or contract terminology. If any part of COVID-related shutdown required for your business to cease, right? So this could be supply and demand if your supply was coming from, especially thinking about that this is a global issue. So China was hit by this months before we actually felt the result of it here in the United States, but it also impacted a supply of a number of things in which we get from China as it would directly relate and impact individuals' businesses. So that's where kind of insurance comes into play. This is where your contract procedures come into play. So especially for small businesses who sometimes are not operating under effective contracts, that's just something to keep in mind moving forward, because this was, of course, not foreseeable. But currently, for businesses that are operating, one thing you want to make sure in terms of potentially protecting yourself from future litigation is that you're complying with the guidance that's coming out. Right, so your protection would be, we're complying with CDC guidance as it comes out in terms of social distancing. If you are an essential business, protecting your employees. Now, if you go into Home Depot or Walgreens or any of these places, you'll notice that they put in shield guards for cashiers, right? So different things where if we have to continue to, you want to protect your employees as best you can. They're telling you about social distancing. You want to make sure that individuals, there's a limit on the individuals who are allowed in the store, because you really have to think about it in terms of slip and fall cases, right? So we know that once you invite people into your facility and they fall or there's a safety issue there, they can absolutely sue you for damages. And so I think in mind, we have to keep that in mind as well for COVID. And the way that you can protect yourself is reasonable precautions, right? So as they come out, if you decide to stay in business, it's your responsibility to make these precautions so that you can protect yourself in the future. Because the worst thing that you could do is completely ignore the guidance. Because then you can be liable, potentially, should there be an issue, especially to your employees. If they're required to be there, they're essential employees, you absolutely want to make sure that you put in the necessary protections for them, as well as their family, and all of these things. So that's really the best thing that you can do right now if you choose to stay in business, is to keep abreast of the guidelines for the CDC, your state and local government, and make sure that you're doing your best to comply and implement policies and procedures and training to your employees to protect them as best as possible.
I think that the focus on the economy versus human life just shows that the element of love has just been lost. I know that COVID-19 has had a significant impact on a lot of things, lockdown, social distancing. A lot of measures have been implemented to prevent the spread, but it's also had another effect because there are heightened fears of domestic violence, which includes physical, emotional, and sexual abuse. I'm not really sure if the dynamic of these disparities have really been brought to the forefront. The value of the human life, just as we can see in the world today, it's not reared as priority. The priority in some cases has been the dollar. And if it wasn't for the people, you wouldn't have the dollar. But I think conversely, there have been just opportunities for companies to engage in being more connected to the community. I think there are opportunities for the community to be more aligned with how they're spending the dollar that they're being provided. Just to be clear, there are a lot of resources that are out here now, and then there are a lot of resources that are not, but there has to have a mutual respect in each sector for everyone to be able to come up with some type of resolve. I think with the fears of the new recession and the financial collapse, times like these call for resilient and strong leadership in healthcare and business and government and our mental, social, emotional, and mental therapists, psychologists. They need support as well because their businesses have heightened. Our medical workers, I can only imagine like how nurses and doctors are still trying to acclimate while quarantine, while still providing the service because of what they've shown. So the human life factor is not just for the persons that have been directly affected to COVID to lead to a death, but you have people who are living, who are providing services to ensure that this virus does not spread. And for the government or for the persons who sit in the office to not see the importance of having the PPE gear and just the funding to support these needs, it just makes me wonder, like, what's more important. So for certain medium and longer term planning, it needs to be reevaluated. It needs to be rebalanced, and the economy needs to be re-energized following this crisis. So if we have a more broad socioeconomic development plan, including sector by sector plans and an ecosystem that would truly encourage entrepreneurship, that's needed as well, because then you will be able to identify and curate sustainable business models that can flourish for all people. So, it's prudent that the government and these institutions constantly reassess and reevaluate this state of play, but also ensure that they value the people who are placing their lives at the front line to ensure the safety of the impact of this pandemic.
We all have our backgrounds and our beliefs, and not to shake that. The fact is, I tell people, Corona don't give it doesn't care what age you are. It doesn't care what ethnic background you are from. It doesn't care. It is a virus that is at least 2 to 3 times more transmittable than the flu itself. And it's an organism that wants to live. So it's going to do what it can to transmit from person to person to person. And so we've seen over and over again examples of people who maybe didn't think the coronavirus was real. And now on the other end, they've carried it to, because it didn't impact their body, but it impacted their loved one with a condition, or their loved one of an age where their bodies couldn't fight off coronavirus. So there is that space where you have the space to determine what you do with your body. But I ask everyone, please think of the social responsibility that we have to protect our tribe. Your tribe that are elders, and then your tribe with diabetes, high blood pressure, heart disease, lung disease, and kidney disease. If they're of your tribe, please consider taking the social responsibility to protect them. It's going to be, typically vaccines take years, right? Initially, they estimated it'll take about 18 months to come out with. I know Moderna, is a company that is thinking they can try to push out a vaccine within 3 to 6 months. Realistically, I think it's going to be a little over 6 months. The thing I want to stress is, whatever, we've seen it time and time again. When the vaccine comes out, the vaccine is going to be scarce. They're going to have limited in numbers. It's going to be limited in how fast, whichever, because there's like 5 or 6 pharmaceutical companies now pushing to get a vaccine out. Whenever it comes out, it will take, it will be, the supply will be limited based on how fast the manufacturer can make it. Historically in our country, when that happens, I want to remind people that Black and brown and elder communities typically are the communities that get the vaccine or whatever's available last. So I don't want people, I've ran into people like, oh, I can do this because the vaccine is going to come out. I want to caution, back to taking care of your tribe. Still follow the social distancing. Still wear your mask, because we don't know what things may fall through the cracks with research and how well the vaccine is going to survive in a person's body. We don't know that,
The hardest thing that I had to go through with this experience working in New York, like, as you guys know, it's the epicenter. The amount of bodies that I had to bag and the amount of deaths that we had in the beginning when I first got there were more than I've ever had as a nurse in almost 10 years. So for me, I'm like a people person. So I love talking to people. I love having relationships with my patients. That is why I became a nurse instead of a doctor, because I felt that I would be able to spend a lot more bedside time with patients than if I would have become a doctor and only get to see them for a short amount of time. So that was the part that like tore at my heartstrings the most, especially working in the ICU, because these patients were sedated, they're out of it. So, you know, their families go from seeing them, and basically like when you first come in the hospital as a patient during this COVID time, you're not allowed to have any visitors, as I'm sure most of you guys know, what the hospitals have been in most states. Now they're starting to reopen it again, but during that time, you know, a person would send in their mom, their dad, their brother, their sister, one of their kids, and then not know if they were ever going to see them again. And you're going on to units where people are doubled up in rooms. They're supposed to have a phone for every room, but when a patient starts to deteriorate and get worse and worse and worse, and then eventually if they're in the ICU, they're having to have a breathing tube down their throat, you know, like they're not interactive at that point anymore. And so as any family member, it's so difficult because you basically just don't even know what's going on throughout the entirety of their care. And so for us, especially like with the nurses and the doctors and other members of the healthcare team, that was like our most important part, to like humanize the experience. And I used to always also tell family members to drop off pictures to put in the rooms, for doctors, for nurses, to everybody that comes around, like to realize like this is a person. Just because we're losing so many people and it's starting to get to the point where you lose so many people, it just hurts a lot and you start to become numb to it a little bit. We had to really find ways to really like humanize the patient and make sure that, you know, you're still loving on your patients the same, and making sure that your families have access to information about the patient. And even more so than if they were there, because having a family member that's sitting right there is, as we all know, like it's nothing close to being able to be next to that person. And I have literally had to hold up my FaceTime on my phone to people while they say goodbye to their family members. And it just rips your heart out, because nobody ever wants to have to, for one, say bye to their family member, but to like not be able to let them go out surrounded in love, surrounded by hugs, by physical touch, by, you know, words whispered in their ear. It was really, 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 really hard for me. It's something that you don't wish upon anybody. And so as much as I possibly could, I would FaceTime with family members daily with their family member, just to, you know, show them their face. And some people it's a lot, because it's not, especially in the ICU, it's not what your family member normally looks like. And that's, some people can't see their family members like that, because it's not them. So just the whole process from start to finish of coming into the hospital, and then if they don't make it out, and having to break that news, because, you know, it would be sometimes perfectly healthy people, and their families just don't understand how you can deteriorate and how you can crash that rapidly. So it was a rough process.
Now, that's actually an issue that a lot of businesses are dealing with right now. Because, one, if you are an employee, an essential worker, and you have COVID, of course, you have to self-quarantine. And then if your job is impacted secondarily by the COVID, then you are eligible, A, for unemployment, and then now you're eligible for the additional funds that you have over and above whatever your normal unemployment is. So what we're seeing now are claims that some employee difficult time staffing positions. One, because sometimes the individual may be making more on unemployment, which is not an issue for the unemployment. It's more an issue because of what our minimum wage is right now, a variable. But so one, you have to require people to self-quarantine, right? Because we talked about liability as well, and health and safety of the employees. Mm-hmm. And now in the alternative, I do think, especially for a lot of the small businesses, what I've seen are some people utilizing family members to come in and assist them. So you really have to be creative. Yeah. As everyone has to be creative in this, but atmosphere. And some people are still hiring too. So for individuals who are looking for jobs, we've hired the grocery stores with shifts and kind of like as people are being laid off. There are job opportunities for people who are looking for work as essential workers and as not essential workers. But I do think that it does become a little bit more difficult, the hiring piece of it. So you really have to be creative. You have to be creative in what you can offer to employees as incentives, because even now, like the federal government has not said anything about hazard pay. These people should be receiving hazard pay, right? And that should come from the federal and or local government to assist if you want people to be employed at this time. So, and those are some things that are really outside of the hands of the small business owners, right? That really has to be the responsibility of local and federal government to give them the support that they need financially, because business owners are struggling right now as well, trying to stay afloat. So I've seen this discussions about hazard pay, which is a no-brainer at this point. And so we're hoping that we can move forward to that. But it really comes to one, incentivizing for individuals to come and be an employee. And I think a part of that is safety precautions, right? Nobody's coming if you're not gonna guarantee that you have some type of protection in place for your employees, first of all, in this kind of atmosphere, and as well as support from local and federal government. But I think that that's something that's going to be a little bit longer down the line, because I do think that we're going to be in this weird new normal place for quite a while. So we're all going to have to adjust in a way that's necessary. And unfortunately, it requires a lot of support. So I am in Illinois, and Illinois has done an amazing job of self-distancing, an amazing job of unemployment, of supporting workers. But from a federal perspective, right, we don't have the leadership necessary. So then when you look at state to state to state to state, unfortunately, it's mostly political, where people don't want to do the unemployment. They want to force you to go back to work. Mm-hmm. It's crazy. So it varies from where you live. And I've lived in Texas as well as Arizona. So I know the blue state, red state. But the political part of this is crazy, because you want it to be about lives and then about supporting small businesses. But in so many places, this is becoming about so many other things other than supporting business and supporting employees and kind of moving forward. And so that's really the sad part about it. But it's going to vary based on where you're located. The support that you're going to receive as a small business is going to vary state by state, city by city, honestly, based on who your local leadership is.
The undeserved communities literally have had limited access to COVID-19 testing, which has been proven in a myriad of states, as well as in their inner cities. And I think because the documenting and the informing the public of the demographic analytics is critical. Like that, this population has been a target, in my opinion, and there are facts to support that. We can't focus COVID's impact without also referencing the elderly population that is getting hit the hardest by the virus. You have persons that are living in long-term facilities where they are near other residents, and then the facilities are experiencing staffing shortages. Poor infection control. The accessibility has shown that the positive tests or deaths in facilities have increased dramatically. The socioeconomic struggle before COVID was already high. Now it's compounded, like with the likelihood of getting the virus and then infecting somebody else. So our communities face an equitable disadvantage. They face a equality disadvantage. They face the disadvantage of really having powerful platforms to support them in this manner. I think that when you look at it, we are aware that unconscious bias is real. But even in this experience, we have to move our thinking from the primitive reactive parts to a more reflective level mind. And so to me, for all of the communities, but specifically the undeserved communities, COVID-19 is a wake-up call for our nation, specifically our healthcare industry, people, to make sure that they are protecting themselves and being able to help and protect the inner city hotspots that we have. In turn, collaborating with just different agencies, making sure that churches and community leaders are involved in this crisis, providing education really on the health disparities. I mean, and the impact that it's had on those specific communities. I think Cardi B said it best. I can't remember what interview it was at first, but she just said everybody does not have the luxury to be in a big house, and just stay away from people. A lot of people are in smaller spaces, smaller apartments with multiple people. So if I'm an essential worker and I catch it from somebody else, I'm going home and I have the coronavirus, then you are more likely to give it to your spouse, your kids, than anybody that's around me. And that's what happens a lot in our undeserved communities. So I think my question is, because we once had it, but why wasn't and why hasn't the government prepared itself for the pandemic in this regard? And when you look at it from an economic perspective, the pandemic is questioning the meaning of globalization, and the organization of the world economy could be very different after it subsides. But where have we not filled the stopgap? And the evolution of this virus, nobody really knows. We have models, but the government should really follow the advice of the experts, the public health officials, some other economists, for the gradual opening of the economy, and also provide not only legal protection, but healthcare protection for the undeserved populations, undocumented populations, who are vital to the sector agriculturally, and in other services where you have a highly concentrated disparity of resources being provided. The recovery is going to be slow by design, period.
I have my baby Alpha. She's 3 years old, and I actually had to board her because, yes, you can transmit the coronavirus from pets too. Those doggy kisses and things like that Alpha loves to give me, and I love to get. I'm not able to get them. So myself working in the COVID tent, I'm on my way from one COVID tent to another one that's opening up today, reopening today in Little Village. And I had to board her. I had to send her to a home of someone that was always home and not going to be going out because, yeah, I didn't want my baby to get it because you absolutely can transmit it. So the CDC actually has guidelines on how to live with your pet and kind of what to do if you have coronavirus, and kind of not handling your pet right now or interacting with them except to put food down and things like that. It's hard. It's hard because any pet lover or pet owner feels me on this. Every time I say it, people kind of laugh, but it's real. It's real. That's my baby, and it is heartbreaking. But yes, you can.
The most difficult part of this is being in New York. This whole time you see all this stuff in the news about people being wrongfully arrested because they don't have a mask on, being abused by the police for not having a mask on in certain neighborhoods. And then I'm protesting last week, and all the police officers everywhere do not have masks on. And so basically, like with the companies that we work for, we all stayed in hotels in downtown Manhattan where most of the protests started or finished or were there at some point of the protest. And there's about like 7, 8, 9 protests a day. So Manhattan started shutting everything down at 8 o'clock for their curfew. And every single street by my hotel was blocked off, which had police officers at every block. So one of the last days I was there, I asked them, just wondering what their policy was on it about wearing masks. And every officer except for one had an attitude when I asked them about it.
Wow.
Questioned me why I was asking them about wearing masks and telling me that they did not have to wear masks because they social distance even though they were standing right next to each other. So I talked to them more and I told them, I said, hey, I'm a nurse. I've been working in New York. I've been risking my life every day. So I said, it's very frustrating to do all this work and we brought the numbers down so much in New York that now I'm going out to see. And it's not the protest, like all the protesters, they all had masks on. Everybody has been doing very well. Like seeing New York as a city, it was amazing to see everyone. Pretty much everyone listens to wearing a mask all the time. Like you can't even go in stores if you don't have it. They don't let you do anything. So it was frustrating to see that aspect of it. And then now coming to quarantine in Florida, nobody has masks on. So when you go places, you ask them to put them on, or I just don't, like, I would prefer just not to go places because I'm not going to get that close to speak to somebody if you don't have a mask on. Restaurants, they have them on, like grocery stores, the checkers have them on, all of those areas have them, but you see a lot of people. So you just, try not to have an attitude about it, but at this be not aggressive, but stern in your approach. And not just like letting it go by the wayside like it doesn't matter, because it does.
Because this has been so widespread, I think I'm pretty confident that a lot of people are probably going to return back to where they were already open. So we can't say that this was limited to predominantly anything communities, right? Because we've seen this in Minnesota. We've seen this globally, right? There is this global fire keg of outrage that has been struck directly related to this George Floyd and these other things, but it is really reflective of so many issues that we see in society. But I think what is important is that for this is one of my concerns about small businesses, right? Target, Walmart, all of these places, they can survive. They're one place or multiple places being destroyed because they have the infrastructure. The question about so many of our small businesses, which I'm hearing now, is that some of them weren't even insured, right? And that is kind of heartbreaking because of the finances and all of these different things. So we really have to wonder what happens in the aftermath. And these are individuals' livelihood where almost immediately they were not able to go back to a location where they probably put their life savings into to build a business. So that is significant. It's absolutely significant, and people have to be sensitive to that. So what we've seen here in Chicago, honestly, is that a lot of individuals, a lot of community members have come together to support small businesses, right? And I think that this is a time when you have individuals who cause so much destruction that we can also have individuals that can actually build up the small business owners in our community because they are providing resources, they're providing jobs for our kids and teens and other adults. Like, they are really providing so much for our community. So I think for those who are not insured, they need to evaluate resources from the city, right? Because we've seen recently, and this is so nuanced and so new, but particularly in Chicago, we have seen that the mayor has decided that they want to support small businesses. Why? Because they want them to stay. We need them to stay in our communities. And so we see that there's going to be support from a local level of the local elected level. But I recently saw that there is a local organization in Chicago. It's called My Hood, My Block. In 2 days, they raised $1 million to support small businesses. So this is where we have to recognize that as individuals, we also have power to rebuild and support these businesses that we want to stay in our community. So I think I don't want to so much focus on what business owners should be doing right now, but I really want to focus on what the rest of us, honestly, that have the means and are able to, what we can do to support them. You have to stop always taking because small business owners give a lot. This is an opportunity, honestly, for us to stand up, for us to support them and have their back in a way that they do for the community, whether or not they let you slide on payments. I've heard so many stories of people saying, I didn't have money, this manager let me get baby formula. They always let me do this. They let me come in, you know what I mean? Or they volunteer, they do different things. I think that as people, we can support business owners now more than ever, and this is really the time for us to show them that we want them to stay and that we appreciate the resources that they provide for our community.
I think one of the biggest differences of the businesses versus the governments is that a lot of the businesses are now deemed essential, and we still need people to continue business as usual. For some of the government entities, they can work from home, and though they make decisions, they are not a part of the daily routine. And I really believe that the difference between essential versus non-essential can be very subjective. And once again, it comes from the top. The lack of leadership and the lack of professional competence as it relates to how this socially constructs and incentivizes division among people, and how people are viewed in their capacity is relevant. I do like to come from an asset-based mindset, though. I do like to say that, you know, the truck drivers, the janitors, the engineers, the group of people that people kind of looked at as like, oh, whatever, like those are our heroes. In addition to our doctors and nurses, they are keeping the company open. I mean, keeping the world going. My father's a truck driver, and every day I'm like, when y'all eat that chicken from Purdue, like that's my daddy. Because they're putting their lives on the lines in these plants, even with Amazon, you know, just being available. And I mean, let's just be honest, the government has not really shown us specifically and holistically how their support and their grassroots connection has been a part of the solution, and not so much a part of why the problem has exponentially been at stake.
Well, it depends on what area I'm in. Like in WizKids, the camp that I teach in, I think that they're really well adapted. They know how to log on. They're really tech savvy. But if I'm talking about my school that I teach in during the year, it just depends on what they have at their house and who is available to help, and if they are tech savvy, if they can figure it out, if that's even available. I think that in some cases it's a huge struggle, and in other cases I think that I mean most households have a cellular device, but you know there's other distractions that they have to deal with. They may have to watch their younger brother and sister, you know, they may have to be at their dad's one weekend or their mom's the other. So it's just a lot going on that I'm sure they deal with. But to be honest, like out of 19 kids, I probably had like 9 that would, not even 9, 5 that would really faithfully check in every day. And maybe about 9, 10 that would touch base within the week. And then I had the rest, 2 I never even heard from at all. I mean, reached out multiple times. And then the rest of my students, it was like, just, you know, it's, some of them were laid off. Like I had one mom reach out to me and say, I'm sorry, it's been 2 weeks, but I couldn't pay the light bill. I didn't have electricity. So, you know, it's just a lot of stress, I'm sure. And I can't even imagine being that young and going through no school, no social friends. You know, sometimes school is like the safest place for them to be. And, you know, now we're all wearing masks, like, you know, just constant. It's just such a reset. It's so weird and abnormal. And then with everything going on and seeing that on the news, like the George Floyd thing and just the Ahmaud Arbery before that, and just so many hits. It's just, I don't know, it's just a really devastating time in my heart.
social distancing is enough when you have on your mask? That's a wonderful question. Absolutely, in an aerosolized environment. So we live in Chicago. The winds are crazy, right? Crazy high at times, enough to aerosolize or pick up a particle. So if you look at the ground sometimes, and when the wind is high in Chicago, and you see leaves literally being lifted off the ground and carried away with the wind, that leaf does weigh more. You're absolutely right. That leaf weighs more than the viral particle, right? And so a virus is going to be able to be aerosolized or picked up like that leaf. That leaf is aerosolized, let's say. So picked up and carried on the flow of the wind. It's a real thing, right? But we also absolutely know if I have on my mask over my nose and under my chin, then it is already stopped 70%. But even the more so, say, if the other person who has coronavirus has on their mask, right? That's why the mask is so important. And it's like hand in hand, that 6-foot social distancing with the mask. And it's best when one does not go without the other.
So right now, it's not directly focused on minority business owners. So as a part of the CARES Act, which was directly passed in response to the COVID crisis, there is this thing called a paycheck protection program. It's the PPP, and it's being administered by the SBA, Small Business Administration. Now, there's been in the news a lot recently because there was an influx of funds as well as applications. So what I will say is that one is that banks are still processing applications, right? So the best piece of this is that if you are already a client of a bank, that you should apply for the application through that bank. Because one thing that people don't realize is that the banks, because they're getting an influx of applications, they're processing applications from customers first, right? Which is perfectly fine. It's not illegal, but it just makes sense because they already know those clients. And there are some other compliance issues that you have to go through, like know your customer, that are anti-money laundering things, right? So there are reasons for that. So if you already have a banking relationship with an institution, you're going to go through that bank because that might be your best option. 2, you also have to recognize that technology is an issue. So when we look at certain banks that have vast technology, your Chases, your Fifth Third versus the smaller banks, that was also some issues with applications as well. And even more so much that the SBA decided to kind of like put the big banks off of the system, right? Because of their access to technology, their applications were getting processed, right? So that's one option. The PPP, which comes from the federal government through the CARES Act. Now, a lot of states are joining in because they're also providing support for their local small businesses. Why? Because they have an incentive, right, for tax revenue to keep those businesses there. So you can also look at your state attorney general website and your local mayor's office to determine if there are new programs that are being rolled out. And if we're looking at federal legislation, we know that Congress continues to consider future stimulus checks, right, as well as future funds for the business community. So even if it's always a good idea if you have not applied to apply for the PPP loans. Now, what they're going to be looking for is proof of revenue. So this is where your financial documents for your business are going to be very important, as well as the primary purposes if you use the funds to pay out salaries, you do not have to pay the loans back. Meaning that you're going to, in an organized fashion, list your employees, what their salaries are, what the anticipated salary that they would have received. If in fact you've had to take a break because of the COVID. So they haven't actually worked, but we want to continue to be able to provide people with paychecks as to keep them off of unemployment, right? Do you understand this whole objective from the federal government? So you want to be able to properly document your employees who have been on payroll prior to this, right? It has to be prior to January 1st. Not all of a sudden I got a business and I got employees and I want to apply for this loan. That's not how that works. So it's really important to have your documentation in order, and then to verify that you did utilize the funds to pay salaries so that you don't have to pay it back in the future. And we've already seen some reports of fraud, so you want to make sure that you are doing everything on the up and up, because they are going to go after some people when this is over. I strongly believe that. Just because they're not going to let you take advantage of this particular situation. So just make sure that your paperwork is in order in terms of salaries, income, people who are already on staff, and how you're going to be processing those funds, which is important during the application stage to be approved, and then thereafter, if you're one of the lucky ones, to actually be approved for the program.
Quote from attorney Peavy. Right now, state governors and business leaders are handling this pandemic, whether you're mad about it or not. State governors have implemented stay at home orders based on the guidance provided by the medical community to one, protect healthcare workers, and based on data and the availability of hospital beds, PPE, ventilators, the density of their city and current population. 2. Protect city employees and first responders. 3. Limit unnecessary travel. 4. Provide resources for those impacted by layoffs. And 5. Protect school-age children.
Remember the mask education, the education regarding should you wear a mask, what type of mask should you wear, and how you should wear that mask. It's still important.
All levels of social distancing, the homemade mask, hand hygiene, I think it's all effective. I don't really think that they can do like exact numbers statistic wise to show and that it would actually be accurate. So I don't know if there's a way to calculate that numerically. But I think that anything that's covering you up, it's preventing the spread of, because you're coughing, you're sneezing. If if you have COVID and you're out in public, it's going to prevent you as a COVID positive person, if they are out and they don't know it, from getting those droplets on anybody else or any other surfaces. So I think it's a very effective way. You can look at the numbers too, just see how effective everything had been with the quarantining and mask wear and hand hygiene. I think with those three things, that's why the numbers went down. You can see, and I can tell you just being in Florida over this last week, I was looking at the numbers. There's an article that Bloomberg put out like this week, and it was saying that the numbers in Florida this week have raised, since they reopened up, they have raised the highest that it's been in the 7 days than the entire time this COVID pandemic has been happening. And when you go outside, you see why, because people are not wearing masks at all. And it's scary for you to be out in public because they'll wear them at the grocery store, they'll wear them if you go to restaurants, but if you're out walking around, like you'll see nobody with masks. So I advise everyone to, I know in some states, like when I go back to Houston, nobody's wearing masks anywhere either, but it just like made me cringe, and I will not be just going out in public for a while, because it's just, there's too many people that are just not taking it very seriously and just acting like it doesn't exist. But just protect yourself. If you have kids under 2, they technically don't need to wear them, or if you have like a lot of other respiratory issues that are going to prevent breathing effectively with it on. But for the most part, anything that you can make, you can use bandanas, you can use 2 pieces of cotton that you put together and sew it or pin it, like however you do. They're everywhere online. If you need some, I have a ton extra. I have people donating them. You can always hit me up to get one. But they're everywhere, so it's easier just to wear them and be safe.
So historically, when we first started and coronavirus first hit the U.S., we were really focused on those N95s because we thought that the coronavirus was aerosolized, meaning it would be able to be substantially pushed, and its particles will be pushed through air, right? N95 masks are still good, but now we know you can wear a surgical mask, which are the typical blue and white or purple and white masks. And in a lot of places, we talk about cloth masks. It helps if those cloth masks have a little pocket that you can put a coffee filter in, but very important. Mostly important is no matter what mask you choose to wear, all the way over the nose and all the way under the chin is very important. If my nose is out and my mouth is covered, the mask isn't really providing the level of security that I need. People in a certain area, city, town, state, have coronavirus. It is safe, but you have to check with your local, district, your local area. That being said, a young child is not going to hold in place in their mind the fundamentals of 6 feet social distancing, right? I think a lot of organizations like schools, they are putting in place ways to make sure that young child has their mask on, continues to wear their mask. A lot of schools are still saying and doing, I used to be a teacher myself, a lot of schools are still saying, hey, I understand that, but we're going to go ahead and maintain our online, services to maintain, because if you have an average 30 kids in a classroom, I've never seen a classroom that was large enough to maintain that for those kids at 6 feet. 30 kids at 6 feet, that is 6 feet in front, 6 feet on side, 6 feet on back. I'm not seeing that kind of classroom design. So that is something that educators and our educational leadership is going to have to take into account as we move towards reopening, making space for those kids, but also with playing. So what we've done, and I'm speaking so I have a niece and nephew. Their names are JL and Caleb, and and those are my babies too. So what we've done is they learn online. They play in the backyard. There is a lot more time with family play with the mask than necessarily kind of going outside and and interacting with the other kids on the block. Hand sanitizer is important. Showers before the kid goes out, but if they must go out, showers as soon as they get in, right? Because we remember when we were kids, I was climbing trees, touching stuff, digging in puddles, doing all kinds of stuff, touching my friend's face, picking my friends' noses and stuff like that. We do that. Children are explorative. So making sure they are doing showers before they go out, showers immediately when they come back in, if they must go out. But any kind of play without social distancing is not recommended at this time,
Yes.
For me, I haven't had a lot of disruption, and it's really because I don't do a lot of customer-facing interaction. So for what I can do, I can work from home. I really just support the business, but I'm also with a global bank that has locations in Asia, in New York, in Canada, and here. So to be honest with you, they've been looking at this issue from a business perspective for much longer than when it came to the US. And actually our China counterparts are just coming back into the office. So they're giving us notes on what the aftermath looks like, right? They're all wearing masks and how they reconfigured the office. But I think initially on, for us, it was a large toll on IT, one, and a large toll on making sure that customers had access to funds, right? Just imagine that. So customers and also businesses who have to make payroll. So a lot of the focus was on them, because you have a panic of a global pandemic, but there's a whole different panic when people feel like they don't have access to their money, right? So that was a huge transition. And now what's happening is, as all of these things are passing in Congress, we're just trying to figure out the best way to service our customers and clients who are applying for loans, who are applying for small business aid and need assistance and even need forbearance, right? They can't afford to pay their mortgage and all these things. So a lot of what we're doing is really focused on the customer and consumers and helping them financially with next steps, with car payments, deferments, all these other things that we're doing just to kind of be a really good corporate citizen, basically understanding that there is a pandemic and that right now the focus more so has to be on individuals, right, and not necessarily on business. so as it has been in the past, or profits. So I think we're doing a really good job of that, but people are working around the clock. And you don't see that piece of it. Like, you don't see that people are working 17 hours a day to process loan applications. These are all individuals as well, but they're also at home with their kids too, right? But online at their computers all day long. So I think more so we're just working around the clock more so, even though we're at home, but just understanding the importance of our roles, and that we kind of just have to do this to support people, and looking at the layoff numbers and, you know, people on unemployment, and just being mindful of all of these things.
We were just like assigning work and like having the kids check in. But now that I'm teaching summer school, it's a lot different because you actually physically have to be online with the children on Zoom for the entire 45 minutes to an hour of the session. So having to kind of arrange, you know, who's going to watch the kids during that time has been really difficult, because you kind of have to, like, at first I was going to work 6 hours, but then again, the camp numbers weren't as high, so they cut my hours down. So I only really have to do 2 a day, but even with that, it's kind of a challenge because it's trying to coordinate. Okay, can I put him in the high chair and put Daniel Tiger on while I'm like in the room teaching? Because it's hard for little ones to be away that long. So, but God always works it out. So
I am also in the educational world too, and it has affected all levels of the education system. Just building off of what Jen said, I mean, from preschool to tertiary education, like there have just been a nationwide closure of like all facilities, you know. I think that I read somewhere the data was saying that by July it would be like over 1.5 billion affected learners in each of those different levers. And so the global impact of this has just allowed and forced us to come with an innovative approach on how to reach our learners and reach our families. The impact of social mobility, though, whereby schools are no longer able to provide free school meals for children in undeserving communities, you know, social isolation, school dropout rates, the services that were usually ongoing for these students and their families have just kind of been modified. And so it's had a significant impact, you know, for families that have childcare costs, that are essential workers, and then for those who are not used to having their children around as long as they do, it's a big adjustment. So I just think that there lies a disparity amongst the populations with higher income who are able to access the technology. You know, we have that equity fight again. I think when I take a look at the entertainment world, it's affected a lot of the entertainment world as it relates to production, but it's also provided innovative approaches for them to really reach out to their base of support. I have to just shout out Instagram, like Fadia with the whole Versus thing, supporting Swiss Beats and Timberland. Like, music is the healing facet for me, and they've just created a space where artists come together. Anthony Hamilton has done some, you know, free concerts. Different execs like Alicia Fant from Columbia have hosted like a myriad of different types of conferences and digital conferences, whereas we didn't have that access before, right? But now COVID and just some of the other unrest that we're experiencing has allowed an open door for people to feel even more connected to people in that. Valicia Butterfield Jones hosts, you know, master classes for women, you know, from branding to understanding how to deal with the pandemic to just having that self-care check-in. I think the awareness and the consciousness of how important it is to check in with yourself while you're simultaneously checking on others is the new normal for a lot of us, and it just allows us to be influenced from all sectors. So though there are a lot of things that are opportunities, there are a lot of things that have become strengths, because like we talked about earlier, the human factor is becoming more present and prevalent, and we're unlearning what we thought we knew and relearning how to really connect with people.
How has
I just want to tell you guys, I just love that all you guys are talking about how this whole entire time has just basically made us refocus and recenter on the one-to-one interactions, because I feel like this whole technology era and just working in the world we work in, that is the huge thing that we've been missing. And I see it in the healthcare industry too, and people are not treated like I was just saying when I was talking about, like losing family members. It's all about prioritizing a person at a time and making a person feel like they're important, and actually doing the things to let them know that their presence is important in this world. And one thing I've noticed in the healthcare system too, this has made just like being in New York and just like being in Houston before I left, it has made nurses like band together a little bit more, and just going into something you don't really know what to expect. It's really weird, because I talk to my friends that work in other areas of the country, and then I talk to my friends that worked in New York with me, and it's like we live in two entirely different worlds. Like it's like we were in a twilight zone in New York, because it was such a high prevalence, and the things that changed in that aspect of healthcare are just so drastically different from what it normally is. Like we weren't even able to provide proper nursing care or proper medical care at all when I first got up there. And that's why they FEMA had brought so many nurses up there. But then in other aspects of the country, or other areas of the country, it was so overstaffed to the point where everyone was getting canceled. So I just think that it's just going to I don't think it's going to change the staffing or anything, only when there's high instances of it, because then they'll just employ like higher agency nurses to come to that area. But I don't know if it's really changed a lot of the other healthcare aspects doing inpatient care. It just makes you more conscious about hand hygiene. But as nurses, like we should all be doing that anyways, and like wearing proper PPEs. The biggest thing that I noticed, like working in a hospital, is fighting for proper PPEs, and especially in areas where you don't know whether your patients do have COVID or they're like a rule out patient, like in a lot of the other hospitals throughout the country. You got the Rona too. Throughout the country, like in areas that they don't necessarily know whether the patients are COVID positive yet and they're ruled out patients, or it's just in general patient populations, I feel like that's the area sometimes really hard to work in as a nurse, because they're not as protected as you are if you're working in COVID areas where you're going to get an N95, you're going to have PPE to cover your body. And that kind of that's the biggest thing that we need as nurses and doctors, is just making sure that in the future with how we provide care, that we're getting proper supplies that we need, because for the longest time we're not. And there's still a lot of hospitals that are really short on supplies. But like we don't conduct our job with social distancing any different, because we still have to go into patient rooms. We still have to have and we are all involved in direct patient care. So we can't limit our numbers of times that we go in the room if a patient asks for us. We can't limit like our interactions with anybody really other than the family members. So
I manage 5 clinics for Howard Brown in our region, and we've totally shifted, right? We before had like one of our 40 something practitioners was doing telehealth. Now all of us do telehealth, and for every clinic we have one person on site in case someone needs it. Because we have to reduce the traffic of people that come in, and then we want to reduce the likelihood that in our clinic facilities, because we share a lot of our clinic facilities with other entities. We're in buildings and not just a standalone Howard Brown. We don't want to create a space where people come in and kind of spread the virus, right? We've also built out tents in the back. So we're a clinic. When people don't feel well, they're going to come there. Say that person doesn't feel well and they describe the symptoms of coronavirus or COVID-19. They're directed to the tent so they never come in the building. We screen them for coronavirus. We've also developed a whole calling system to call people back, give them the results and walk them through the process if they're negative, and also walk them through a process of healing and access to food and things like that if they're positive. And then the last thing we realized we had to do, if we really want to be honest about and really want to play into this shelter in place, which is the number one recommendation to prevent coronavirus. And if we have time, we can get into why that's the recommendation. And, but it sounds simple, but it works. So if we want to support that shelter in place, we need to have a mobile unit. And so now we drive around to areas and test, so that person doesn't need to come out, get on the bus, touch the bus handrail, touch, that kind of thing, to support communities that have been severely impacted, either by transmission or by higher death rates than other people. So we go into those due to COVID. So we go into those areas and we provide screening. So it's changed the practice a lot. The most important thing that I love about my practice is because we're community focused, like I said, we are, our focus is community healing. We were able to pivot. We were nimble enough to be able to pivot when the community said so. So that's important.
From an economical perspective, yeah, we got a $2 trillion stimulus package, but we need temporary state-led reorganization of the economy. And that's just it, because we don't have the resources available to support the need. Yeah. And we don't have a government intervention to address the deepening public health crisis that this is going to show exponentially.
Economist Kristie, quote, "What are you willing to do, give up, and become when the tide rolls against you and not with you? Black people in America can tell you that we have learned to anchor when needed and sail when we want. The tide, the ebb, allows us to flow. Collective impact and false collaborative effort."
Originally, I worked on like a med-surg step-down floor, but when I worked in that area, it was so understaffed. We'd have like 8 to 12 patients. Sometimes you'd have 5 or 6 on a good day. And normally on these units, you cannot ever have a patient that's on a ventilator. Ventilated patients, which is like when you have a breathing tube down your throat, usually when you're intubated, or you can have a ventilator, like a CPAP or a BiPAP machine also to help you breathe. But most of the time, if you have to be on anything more than like 12 hours or more than just for sleep, you have to go to the ICU. So you're basically taking, med-surg nurses that have never managed these patients before, and you're putting these type of patients on the floor. But when the whole entire hospital is like this, you don't really have a choice but to do that. And so I just lost my train of thought. What was the question again?
How many colleagues or people lost?
Oh, yeah. That's what it was. Sorry. Okay. Good thing you can edit this. And so you see in the beginning when we did not have a ton of PPE, and when it first started, when the whole pandemic first started in New York, there's a lot of sanitation workers, a lot of housekeepers, a lot of the staff that a lot of people take for granted and don't really value as much as we should, even though they're the ones that are cleaning up our entire rooms with all the infected body secretions. They're coming in contact with the patients every day as well, and not necessarily always having PPE. And I know in the beginning they didn't have PPE. I was mentioning to them earlier, in the beginning at my other hospital in Houston that I was working at, I had to really go to bat for some of my housekeepers because they would give me an N95, but they didn't want to give my nursing tech, or they didn't want to give my housekeeper an N95. And so I just would tell them, like, don't go in the room. I don't want you to put yourself at risk. And then they received pushback on their end too. So being in New York, there were 2 like really major losses that were coworkers, not on my necessary unit, but basically like the whole mama of the ER. She had been at that hospital for like 20, 30 years, was getting ready to retire. She ended up passing away from it. There was a doctor that everyone in the entire building community knew about him because it's very rare for somebody to become educated in the system, be in that area work, go to school and practice their residency or fellowship in a certain hospital, and then also stay in that same community to work in, because that community is hard sometimes. You don't have the resources that you do in private hospitals, like we were talking about earlier. And so there's a huge article online about him. He's Dr. Mahoney, and they called him the Jay-Z of the neighborhood. And you could just see like what a huge loss he was to their community. And then like the other nurse, the head nurse that was in the ED, and all the housekeepers and, dietary people, like I think by the time I left, there was like 15 people that had died from our hospital, just in that 2-month span. And then I didn't have any nurses in my floor that I lost, but several of my friends that I came up to New York with, or other people that I came in contact knew of other nurses. Like there was several nurses that we took care of that, were in their 30s, 40s, 50s, young people that once they got intubated, they never came off. We started to have more people survive at the end. When you work on the med-surg floors, you see a lot more people survive it because you're not having as sick of patients. So you can see them get better all the way. In ICU, it's very different from regular ICU times, because a lot of people going into the ICU are expected to not do well. But with COVID, it literally took probably a month before we had one patient that survived. And we just, every single day, like another patient would die, like out of the same original group that we got. And it was a slow progressive thing, to where some of them, they started to crash very quickly, but then they would be kept alive by all these drips, and you would just see them steadily, their body functions and everything with the disease just continue to, like their heart. They started having a lot of blood clots and heart attacks, and their kidneys started shutting down. Just a lot of body systems malfunctioning. Like we focus on the respiratory system and what the respiratory system does for us, and how, like in the media, that's basically the only thing that they've really talked about. But there's people that came in with perfectly healthy kidneys that then were having to go on dialysis, and, people having heart attacks, people having blood clots everywhere, like huge blood clots all throughout their lungs, when this is something that is not seen with any other disease. So it was just a lot of, a lot of heaviness when you just see even the nurses and the doctors start passing away. And like the housekeeping, just all of it it's a lot. We lost a lot of people.
Wow.
So coronavirus is a virus that started, what we have first knowledge of at an exotic meat market in Wuhan, China. The first case happened in November, but they didn't know what it was. So it didn't have a name. It was like a pneumonia of unexplained etiology or unexplained origin, right? And then we know it's in December in China, there was another case, and 5 of that person's immediate contacts came down with it. And then for each of those, 7 of those, so it went from 1 to 5 to 35 in the span of 2 months. And then if each person exponentially, meaning each person is now impacting 3 to 5 people, that's how it's growing so fast. The name of that virus is the novel coronavirus, right? That's what it is, right? And then the COVID, right? Corona, CO, virus, disease, viral disease, D is for disease. 19 is the year it came out, that's 2019. Yeah, so that's where we get COVID-19.
Thank you.
And that's why it's all caps, because it's actually an acronym. So capital C, capital O, coronavirus, corona, VI, virus, D, disease, and 2019 is the year that it first came out. And that little bitty N that you see in front of it stands for novel, meaning we've never seen it in history before, right? Now, coronavirus is actually a group of viruses. A lot of them cause the common cold. So but the way they impact your body can certainly be totally different. For instance, LA, I don't know how many people you have in your family. I've met 4 of them, right? You are all in the same family, all in the same space, things like that. Your sister is not you. You are not your sister. You both have different ways you move through this earth, things you like and things like that. That's the same thing for coronavirus. Coronavirus is a family, right? SARS-2 COVID-19 is the specific one that we're talking about that's causing this pandemic, right? And so the reason it causes a pandemic is, in order to cause a pandemic, you have to be impactful in a person's life. So when it gets in my body, it's got to do something like more extreme than a common cold, because then we'll just call it common cold, right? But it has to impact it in a way where either I don't know I have it, or it lives long enough in my body without destroying my body long enough for me to transmit it to someone else. So it's a very like window. It has to impact the body, but it can't impact the body and then the person heads to demise or dies like 3 hours later, because then it needs to impact the body and sit in that body while the person walks around, touches doorknobs, that kind of thing, so that it can spread. And so that's the window that most pandemics are in. Any pandemic that you see, like Ebola and the rest of them, that just go through really fast, means it hits your body, but it kills you. You don't have time to transmit it to anybody else. Or it hits your body like the flu one. It hits your body, but it moves so slow that we have time to make a vaccine, right? So I don't know if that answered, but that's the difference between COVID and coronavirus. Shelter in place, preventive methods for any disease are based off of two things: the disease itself, right? But how we behave as humans in the face of the disease. That's very important. And so when you look at prevention methods, then you have to include those two. For example, diabetes. When people, my family, for instance, there's a high risk for me having diabetes. So my doctor's like, hey, make sure you run or get your heart rate up 150 minutes per week. Make sure you take in nutrition that is low in sugar, right? Not because, hey, that's what every doctor says, but because diabetes is actually a disease where your pancreas, the organ that processes sugar in your body, can be dysfunctional or not function correctly. So low in sugar nutrition keeps my pancreas, my sugar functioning organ, from being overloaded. Because just like anything, once you overload it, like if you overload a battery outlet, it'll spark out. So if you overload the pancreas, it's more likely to tap out, and then that's when you actually get diabetes, right? Also, the exercise is to increase my metabolism. Because the pancreas is an organ, all your organs operate off your metabolic system. It's your system that keeps all the stuff functioning, your go system. It's like the motor in your car is your metabolism, right? So you want that motor to be like, come on, pancreas, you can do it, and encourage it. So you want the pancreas to be strong enough and have endurance, and that's your metabolism. But you also don't want to overload it. So metabolism is for the exercise, to keep that up. And then not overloading it with sugar is the nutritional aspect. So when we look at that, your doctor says for primary prevention, the first gold standard prevention for diabetes is exercise and taking good nutrition. Sounds simple, but there's a lot behind the curtain, right? Now let's look at COVID. COVID is a disease that just wants to spread. It spreads faster than the flu, anything like that, right? So it wants to spread from contact person to contact person. It can spread on surfaces like plastic, doorknobs, things like that, counter surfaces. But it can also spread when I really talk to you like this really hard, because when I say that T, I'm putting a lot of air behind that virus if I have it, right? So the best thing to do is not go outside to touch, because if you think about it, when you go outside your door, you touch the inside to open it up.
Wait. You went mute.
Can you hear me now?
Yes. Okay.
All right. So when you think about coronavirus, how it moves, it is a virus that just wants to move from host, meaning myself, to host, meaning my dog, my friend, anyone. It's just trying to survive, right? And if you think about the way it moves, the reason the primary prevention is shelter in place is, think about when you open your door, you touch the inside of your door to open the door to get out, but to close that door and lock it, you're going to touch the outside of the door. And so has the letter carrier, who has also touched every single doorknob on your block.
Right.
They've also touched all the things, the carriers, the boxes they needed to do at the post office, right? Also, when you go grocery shopping and you pick up that orange and you squeeze it, so has someone else with coronavirus, And so the best thing to do, because we have human nature, we're going to close doors. We're going to touch doorknobs to open them. We're going to touch the other ones to close them. We're going to squeeze. I squeeze avocados all the time to this day. We're face touchers, things like that. Because of that, we have to account for that. So the best thing to do is stay at home. And the best way to not spread it to people we love is to do what I call physical distancing. I call it physical distancing because a lot of times when people hear social distancing, they hear social disconnect. But there's certain ways you can definitely connect socially while you're physically distanced, right? And we say that because you think about your loved ones, your mom, your dad, your partner, your husband, your wife, and if you're around them, that 6 feet gets shorter and shorter and shorter. Then you hold a hand, then you hug, and then mommy, I love you. You're doing that kind of stuff. And so that's where the shelter in place and the physical distancing that's why they're the top ones. It's best just not to go out during this time. And historically, with novel coronavirus, countries and communities that do it have better outcomes. So I'm glad you brought that up. If you think about historically our public health and healthcare system, I include myself because I'm a healthcare practitioner. When that young man had the party, when these things when people are having the parties, historically, if you look, for whatever reason, for some people it was just blatant privilege. For some groups it was just blatant privilege, meaning they have the information, but they don't feel the information applies to them because they have better access to care and they have ways to get themselves out of situations, right? Okay, for some people. Or when they go to the hospital, they know they're going to be given the ventilators that LA spoke about. They know they're going to be first in line for those things. So they're like, oh, I'm going to go out anyway. And if something happens, then I know it will be taken care of, right? That's one group. For another group, historically, public health information and the public health institutions were not created for them, and the information is not communicated to them. That's the difference between me talking about antibodies and antigens and all that other stuff, or talking about the COVID virus and your protection from the COVID virus. Both of them stated antibodies and antigens. Both of them referred it. I just use a language that is appropriate for my audience. It depends on your audience. So if historically public health information isn't created for certain communities or effectively communicated to communities, then how? I mean, we know how because we're in a systemic, oppressive society in a lot of ways. But how then do we blame then that community for not doing what we never communicated? It's like I'm in Little Village right now, right? And I speak Spanish, right? But if I go in Little Village, I'm looking at a store right now. If I walk in that store and start speaking in English, and then I want to complain because the person doesn't do what I asked to do, then, where am I thinking? I have to look at myself and ask myself, why did you walk in there? They speak Spanish. Why did you walk in there speaking English? And how dare you? How dare you take the audacity to then complain and blame them, for not understanding what I never educated myself enough to say, So so both groups are experiencing public health information not communicated effectively to them for totally different reasons. And that's the gap we're in. And that's the challenge we have moving forward. Because one thing about coronavirus, it doesn't know a geography. It doesn't know what group you're in. It doesn't know that it's a virus that wants to move from person to person to person through respiratory droplets or contact or surface contact. And it is also teaching us that no community is going to be able to heal without the other one. So we have to heal as a human race.
That's good. That's good, Dr. Green. Okay. So why does coronavirus attack kidneys in a healthy person? How does that happen?
Well, coronavirus is a virus that attacks everything and everybody.
Oh.
Right? It doesn't go to some people. So if you look at it, you know about kids that get the rash and things like that, and people's toes look different and stuff. It's actually moving in the vasculature or in the highways of your body, whether they're the lungs, the highways where the air moves, or whether they're the vasculature, veins and arteries, the highways where the blood moves, right? The kidney has a lot of arteries in it because the kidney's job is to clean the toxins out of the blood, right? So the arteries then go there, and on their way there, if the virus is in there and it attacks it, that's what happens. So coronavirus is actually trying to attack everything on everybody, our heart, our lungs, things like that, right? The question is, for instance, I talked about diabetes, and so I'll use that because I already gave a lot of background. The body, the metabolism, and the pancreas itself, and for people with diabetes, the kidneys have a little dysfunction too. The body is already at a weakened state. And so it gives the virus the opportunity to do more damage. So if I'm healthy, I'm keeping my immune system up. That's why they were like, get your immune system up. I'm keeping that. I'm keeping my metabolism, my immune system up. Then and I don't have any of those things. I don't already have heart disease where my heart is already weak. When the virus tries to attack the heart, it's going to weaken the heart a little bit more during that process. But then the body can fight it off, and the virus will die before it gets time. The virus will die before it gets time to do that. But if I already start with a diabetes, which is weakened pancreas and a lot of times weakened kidneys to start with, heart disease, a weakened heart, kidney disease, a weakened kidney. If I'm already operating at 50%, and then coronavirus wants to take a 30% chunk out of me, then I'm at 20%. But if I start at 100%, and I get a 30% chunk out of me, I'm at 70%, and my body, I'll be in the hospital, I'll feel down for a minute. That's why it feels like that, because your body is like, uh-oh, it's doing its thing, trying to get rid of it. But then after it gets rid of it, I restore myself back to a higher percent than 70. I won't say 100% because the studies aren't out like that, yet about that.
Quote from Dr. Maya Green: I love those of us on a healing mission right now. Let's take this time to see how we move as part of our community. Coronavirus literally thrives in do-for-self environments. We need to move as a unit.
I'd like to say to not quit. I think that it's so easy to just throw in the towel, especially when times get really hard and you focus on the bad. And what the Lord has really been teaching me in this season is to renew my mind with the Word and really focus on the good. So when you see the goodness of God, that's what you need to draw upon. That's what you need to thank Him for every day. I think that it's easy to get on the complain train and just like, oh, this is wrong, oh, that is wrong, oh, this person died. And also, especially, bless their heart, the teachers that look like me, sometimes you just have to be quiet and really listen and kind of get down on just somebody else's level of pain and just really try to empathize and see where people are coming from. I think that a lot of people just have, with this media age, we just tweet it before we eat it. You don't really live it. You just say, oh, this is good, let me put it out, this is good. And I've been a victim of it too, or not a victim, but I've done it too. And the Lord really had to deal with me as far as like, eat this, live this before you say it, and so I just want to encourage all the educators out there, also take care of yourself, have a whole immune system thing. Put my husband through emergency, echinacea, ginger, and
Zinc.
zinc, yes, zinc, also zinc, and just exercise and take care of yourself, because it's hard to, the quarantine, what is it, the quarantine 15, you're going to feel worse when you come out. So take care of yourself and be encouraged, because you are needed and you are somebody else's light, and the kids look to you for guidance. So that's what I want to say. And I also want to say, LA, thank you for this opportunity. And everybody who was on here, you guys are going to make me want to go back to school.
I think the most important piece of this, honestly, is really this idea about caring for others and that we are all connected. And so when we go from state to state to locale, people being upset about wearing masks is absurd, right? It's extremely selfish. But what we continue to see is that people are selfish and not mindful of other people, and this idea of community and humanity towards other individuals. If for anything, humanity for people who are in the medical profession, who are actively dealing with this and quarantining from their family and dealing with this stress, something as minor as wearing a mask is too much for you to do. If there's the slightest chance and opportunity to save another person's life, that can't be where we are as a society. That makes absolutely no sense to me. So, and I think it's this type of camaraderie of like supporting other parents who have kids, people who are essential workers who can't be at home and care for school-age kids who are doing remote learning, right? How can you be of service to your neighbor? How can you be of service to your family member? Where we all really should be coming together as a part of this pandemic. And a lot of communities are, even in the aftermath of these riots, right? All of these, there's so many opportunities for us to come together and see the humanity of the next person, whether it's based on a race, whether it's based on being an essential worker, whether it's all of us trying to survive here and literally make it to 2021, because there's so much going on and so much depth. It just seems like that should be the focus here. And so just for people to check their selfishness, because this is really not the time for that.
Thank you so much for this opportunity. This has been amazing today to talk with all of you other women that are just killing it in your area, in your arena of the world. And if anything, that COVID has started to open up, just like how the continued stuff, that the other stuff that's going on in the world with all the racial injustices, it's just teaching us how to get back to being human again, working together, like paying attention to the most important things in your life, your family, your close friends, learning how to think of everyone when you're going through illnesses like this. Like, oh, well, if this was my mom, what would I want? Would I want them to be left alone in a room by themselves with no love, like no attention, no anything like that? No, like we all want to be loved on. We all want to be cared for. We all need like emotional, physical, mental needs met, just like in the Maslow's hierarchy of needs. And during this COVID time, like we really haven't been having a lot of those needs met. So as we all go back out into the world, it's really important to just be a little bit gentler to people, but also keep, like Kristie was saying, keep your feet on the ground. Like this isn't something that's going to change overnight. The practices that happen in healthcare, that happen with COVID, it's not just going to change from COVID. These are practices that have been in place with overstaffing and, underserved communities, like we were talking about earlier, like underserved communities in public versus private hospitals, they're already receiving less than adequate care the majority of the time. So if COVID-19 didn't do anything, it should teach people a lot about the injustices that we also have in place inside the hospital systems and caring for our more poverty-stricken areas, because there's a huge gap in that area. And then also just be more appreciative to everyone that is around you. You know, like nurses and doctors get a lot of praise during this time, but like we've talked about throughout this entire time, it's the delivery people that are dropping off your packages, the garbage men that are taking your garbages, the people that are working in the fast food restaurants. A lot of those people aren't protected like we are in the hospital. And even though we aren't protected as much as we should be in the hospital at times, a lot more often we at least get some kind of hazard pay. The general public making minimum wage or just regular wages without any kind of hazard pay, they're not really getting any kind of appreciation or love like the rest of us do. So just give them some extra love and tip them a little bit extra and do what you can to build up the smaller businesses that we're talking about that need the help right now.
I really talk about a lot collaborative effort versus collective impact. And I think that what we have to understand that collaboration is a joint effort toward a goal. But collective impact is the commitment of a group of people or important stakeholders from various sectors to a common agenda for solving a specific problem. And right now, the world needs a lesson and an ongoing support for empathy, for leadership, and for community. And building on what Keena, Suzanne, and even Jennifer has said, we have to understand that there is a model for this. There are different phases to this. We have to have, a common agenda. We have to have, community engagement. There has to be some strategic planning. There has to be the moment where we evaluate what we do and see if it's working and go back and remix it. Like, that's collective impact. I love that we can all get together and say, yes, we want to heal the world. But my question is always, okay, well, what's next? Okay, what are you doing? What are you organizing for this impact? How are you implementing this? How are we going to sustain the action and the impact that we just talked about? I appreciate us all coming together and saying kumbaya, but who's going to take the high and the low when it comes to the harmony? So the components for success for us to go into that action part of everything, that's collective impact. And that's where I believe we need from all levers come together to be able to see it through and not just have a conversation about it. I think the last part is that, we have to become a surfer. We can't ride against this tide right now. We got to ride with it. And we have to understand that, like, what are you willing to do? What are you willing to give up? And who are you willing to become in this moment when you see that there is a disparity, that there is unrest, that there is a equitable deference to certain communities and certain people? And how are you supporting the people who are putting their lives out on the line every day to help heal the land? So collective impact is just my biggest thing. Love the conversations, but what's next?
So we're wondering why we're rioting. We're wondering why things are shutting down. And anxiety is going up. Use of alcohol and other things are going up. It's because most of the world is asleep, and we don't recognize we're asleep because we're running around being anxious. But they're literally asleep in a pandemic, meaning the dreams or the visions or the manifestations or the purpose that was put in you. A lot of people have kind of put those to the side. You see people saying, oh, I'm going to drop out of school because the pandemic is just too much. I want us to wake up, take those things back off the shelf. For some of us, they may be dusty 3 years old. For some of us, they're 3 months old because we stopped when the pandemic came. But whatever purpose was put in you, this is the time to wake up. if you look at every genius or everyone who manifested things, from Carter G. Woodson to people that we might not love, Alexander Graham Bell, Albert Einstein, Tesla. If you look at how they slept, they woke up while everybody was asleep and they got most of the work done. They woke up while everybody sleeps. So what that looks like for them is they were up 4:30 in the morning. 4:30 is the average time an inventor or a genius or someone wakes up. They woke up while everybody was asleep and they did most of their work. So while most of the world is asleep on autopilot during this pandemic, go ahead and try to wake yourself up. Go look at what your purpose is and start to make steps to accomplish that purpose.
What have we taken away from this forum about COVID-19? I took away 3 main points that every single panelist spoke about or expressed, and I would like to just give my closing remarks as the host of the coronavirus and COVID-19 forum here. The first thing I took away is the importance of community, which ties in extremely wonderfully with my message as a minister and as a scribal prophet. We are one, and until we reach a point to embracing this fact, we will continue to struggle through this global pandemic. So what I'd like to do is encourage each and every person under the sound of my voice to treat others like you want to be treated, and recognize that we are one human race and we need to help each other. Because if we don't, this is going to be way more difficult than it has to be unless we recognize that we have to exercise community. 2, I'd like to take away the fact that knowledge is very important. The scripture on the flyer is we do err for lack of knowledge. As the experts in this forum have expressed, the disparities exhibited in underserved communities across the board is due in part to being excluded from the mainstream discussions, information not being passed along in a timely manner, and equal health care and PPE not being provided to essential workers and the general public. With the knowledge and information that you've gained from this forum, my prayer is that you implement it into your everyday lives so that we can live healthy, live longer, and be informed about what's going on with this COVID-19. And finally, what economist Kristie talked about, collective impact. Collective impact. This is extremely important. As we have learned from economist Kristie, collective impact must be implemented into our daily lives. We must do all we can as a community within our areas of gifting and expertise to continue to actively move forward during this pandemic, even if we must put forth a bit more effort to achieve actual goals and plans to rebuild. I am your host, L.A. Holts, and I want to thank each and every one of you for taking the time out to listen to this informative forum about Corona and God bless each and every one of you. Stay safe, stay alive, and please take heed to the information given during this forum.